Hey everyone, and welcome back. Today we're going to be diving deep into an area where the lines can get a little blurry.
Oh, yeah.
We're talking about autism and schizoid personality disorder.
Interesting.
We'll be taking a look at a thought-provoking blog post from Cheap ABA.
Okay.
It's called Autism versus Schizoid Personality Disorder, Understanding the Differences.
I see.
Now, these conditions often get confused,
Yeah.
and it can be tricky to tell them apart in real-world situations.
Yeah, I can see how that would be tough. Like, how would someone know?
Exactly. So imagine you're meeting two people and both seem distant and have a hard time showing their emotions.
Right.
You might think they're experiencing the same thing, but the truth is their internal worlds could be vastly different.
Yeah, that's a good point.
So to kick things off, let's unpack what the blog post tells us are the hallmarks of autism spectrum disorder.
Sure.
What are those key things that stand out?
Well, the post points to the challenges with social interaction.
Okay, so like what kinds of things?
Things like having a tough time reading social cues or even knowing how to start conversations.
Right, so it's more than just being shy.
Right. It's like they're trying to solve a social puzzle, but they're missing some of the pieces.
I see, that makes sense.
Yeah.
Now, remember the post also talked about sensory sensitivities being a big part of autism.
Oh, absolutely. For someone on the spectrum, a normal conversation could feel overwhelming.
Really?
Yeah, things like background noise or bright lights, stuff most of us wouldn't even notice can be super distracting or even painful for them.
Wow, I never thought of it like that. That really puts it into perspective.
Yeah.
And all of this stems from the fact that autism is neurodevelopmental, right?
Right.
Meaning it's there from early childhood.
Exactly. It's essentially wired into their brain development. And that's why early diagnosis and support can be so crucial.
It can make a world of difference.
Absolutely.
Now, switching gears a bit, we have schizoid personality disorder, which comes into the picture a bit later.
Yeah, later in life.
So what jumped out at you from the blog post about SPD? Well, the post talked about how people with SPD tend to prefer being alone,
Mm-hmm.
and they often have a really narrow focus on their own interests.
So?
But is that just a fancy way of saying they're introverted?
Not exactly. I mean, introverts enjoy their own company too, right?
Yeah.
But people with SPD have this genuine lack of interest in forming those social bonds.
So it's not that they can't connect, it's more that they truly prefer to be on their own.
Exactly. They don't feel that same pull towards socializing that a lot of us do.
So to sum it up, unlike folks with autism, who
Mhm.
might actually want those connections but struggle to make them, people with SPD are genuinely content in their own world.
You got it. That difference in social motivation, that's a key distinction the blog post really highlights.
It's a crucial difference. Now, another area where these conditions can seem similar is in the way emotions are expressed.
Yeah, that's true.
What did the post have to say about that? The post mentioned that both individuals with autism and those with SPD might not show a lot of emotion outwardly.
Right.
But the reason behind that is totally different, isn't it?
Absolutely. It's a key takeaway from the post. Think of it like this. Someone with autism might be experiencing these super intense emotions,
Okay.
but they have a really hard time expressing them in a way that makes sense to others.
So it's not that they aren't feeling things deeply. It's more about struggling to manage and show those emotions.
Exactly. Like their emotions are dialed up to 11, but they don't have the volume knob to control it.
Oh, I like that analogy. Makes a lot of sense.
And this is totally different from someone with SPD whose emotional experience is kind of naturally more toned down.
Okay.
It's not that they're intentionally holding back their emotions. It's more like their emotional landscape is just, well, calmer from the start.
Right. So it's not about suppression. It's just their natural emotional range. That's a really helpful distinction. So far, we've uncovered some really core differences between autism and SPD. Those developmental origins, the contrasting views on social interaction, and the unique ways emotions are both experienced and expressed.
Right.
And it's interesting because even though both can lead to someone being socially withdrawn, the reasons underneath are completely different.
Totally. And that's where it gets really important, because if you understand the why behind the withdrawal, it's going to change how you approach interacting with and supporting someone who might have one of these conditions.
That's such an important point. It's not about sticking a label on someone. It's about understanding what's going on inside so we can connect with them in a way that's meaningful. But how do we even start to tell these conditions apart in the first place?
Let's take a closer look at those differences we've been talking about. Remember, autism is neurodevelopmental.
Right.
It's there from early childhood, whereas SPD usually emerges later. That in itself can give you some pretty valuable clues.
Okay, so the timeline of when these social and emotional differences show up can be a big indicator. What else should we be paying attention to?
Well, the blog post brings up this really interesting aspect of social motivation.
Uh-huh.
The desire for connection you often see in autism versus that preference for solitude in SPD.
Yeah, that's a big one.
Let's explore that a little bit deeper, shall we?
I'm all for it. Let's dive in.
All right, so we're back and we're digging deeper into this idea of social motivation.
Right. We were saying that someone with autism might really want those connections, but just not know how to make them happen.
Right.
And then on the flip side, you have someone with SPD who's perfectly happy doing their own thing.
Yeah.
Does the blog post give us any examples of what that looks like in real life?
It doesn't really have any specific examples, but we can kind of picture it, right?
Okay, yeah.
So let's say there's a young guy, loves video games. He really wants to share that passion with friends, connect with people who get it.
Yeah.
But he just doesn't know how to start those conversations or really understand those unspoken social rules.
Oh,
So even though he wants those connections, he ends up spending a lot of time alone.
and that's got to be so isolating.
Yeah, it can be tough. And this is where the right support can really make a difference.
So what would that look like?
Well, like helping him build those social skills. Giving him strategies to communicate more effectively.
Right, so he has the tools to navigate those social situations.
Exactly. It can really open up his world.
That makes me think about how differently social situations might feel for someone with SPD.
Uh-huh.
Like if you're naturally happy being alone, a big party probably wouldn't sound very appealing.
No, not at all. Someone with SPD might be much happier with a quiet night at home.
Yeah.
Maybe reading a book or going for a walk in nature by themselves.
They wouldn't feel that need to be surrounded by people.
Right. It's not that they can't handle being around others. It's just that they don't have that same drive to socialize.
That's a good distinction. So knowing this, how can we use this understanding in our own interactions with people who might have one of these conditions?
It all starts with awareness, recognizing that social withdrawal can have really different roots.
So not just assuming someone's being rude or unfriendly,
Yeah, it's about approaching people with empathy and trying to understand their perspective.
and remembering that they might be navigating social situations in a way that works best for them.
Exactly. And if we know someone has autism, we can be more mindful of things like sensory sensitivities and how they prefer to communicate.
Like being aware of the environment and using language that's clear and easy to understand.
Right. And if we think someone might have SPD, we can respect their space.
And not force them into social situations that might feel draining.
Exactly. It's not about forcing everyone into the same mold. It's about adapting our approach to the individual.
Okay, that makes a lot of sense. Now, going back to the blog post, what did you find interesting about how it described the way people with autism and SPD experience emotions?
Well, I remember it saying that both groups can sometimes appear to be emotionally flat, but the reasons behind that are completely different.
Right, it's like they're both speaking quietly, but one is whispering and the other is using a microphone with the volume turned way down.
That's a great way to put it.
It really shows how important it is to understand what's going on beneath the surface.
Like, someone with autism might actually be feeling really intense emotions,
Exactly.
but they just struggle to regulate them, so it comes across as flat.
It's like they're trying to control a volcano of emotions.
And for someone with SPD.
It's more like their emotional range is just naturally more limited.
So how do we approach emotional expression in a way that's sensitive to both of these?
Well, I think the first step is to not make assumptions about what someone's feeling based just on how they look.
Like, just because someone with autism isn't making eye contact or showing a lot of facial expressions, it doesn't mean they're not engaged or interested.
Right. And if someone with SPD seems emotionally detached, it doesn't mean they're cold or don't care.
Right. It's just their way of being.
It makes you realize how much we rely on nonverbal cues to read emotions.
Yeah.
And how those cues can be totally misleading if we don't understand the context.
Exactly. So in those situations, it's important to listen carefully and be open to how they express themselves.
Not just projecting our own interpretations on them.
Right. So if we're talking to someone with autism, we might need to be a little more patient, giving them time to process and express themselves.
And with someone who might have SPD, we might need to be more direct with our communication.
Exactly. Not relying on subtle hints or appeals to emotion.
It's amazing how understanding these subtle differences can change the way we communicate. What else did the blog post say about supporting people with autism and SPD?
It really stressed the importance of tailoring support to the individual. Okay.
not just focusing on the label, but on the person's unique needs.
That seems crucial.
Let's explore that a bit more.
Sounds good. Let's dive in. So we're back, and I think I'm really starting to get how these conditions, autism and SPD, can look similar on the surface,
Right.
but they're actually coming from totally different places.
Yeah, that's what the blog post is trying to get across.
It seems like the type of support someone needs really depends on the individual.
Exactly, not just on the diagnosis.
Like if someone with autism is feeling overwhelmed in social situations but wants to connect,
Uh-huh.
that's going to need a different approach than someone with SPD who prefers to be alone.
Absolutely. For folks with autism, the post talks about focusing on building social skills and communication strategies.
So what would that look like?
Well, it could be things like social skills groups,
Okay.
maybe some speech therapy, or even just practicing everyday conversations, in a safe space.
So they can get comfortable with those interactions.
Yeah, exactly. Now, for people with SPD, what kind of support would be helpful?
The most important thing is respecting their space and their independence.
Okay.
It's not about trying to make them more social.
Right.
It's about understanding and accepting that they genuinely prefer solitude.
So it's about helping them create boundaries
Yeah,
and advocate for their needs in a world that often values extroversion.
exactly. And finding ways for them to connect with others who share their interests, if they want to.
Like maybe smaller groups or online communities.
Right, where they can engage on their own terms.
That makes a lot of sense. It's about finding those connections that feel genuine and right for them. Now, I'm thinking back to the beginning of our conversation. We were talking about those two hypothetical people who were both socially withdrawn.
Right. And how you might tell the difference between autism and SPD.
Exactly. So what are some things to keep in mind?
Remember, we're not trying to diagnose anyone.
Of course.
The point is to use this knowledge to guide our interactions and approach people with empathy.
So instead of jumping to conclusions, we could look for those subtle cues that the blog post highlighted.
Right, like the developmental timeline, the social motivation, and how they express their emotions.
Exactly. And if we're not sure, it's okay to ask questions respectfully.
Yeah. Or just observe and learn from their behavior. The key is to not make assumptions.
And to treat everyone with kindness and respect, no matter how they present themselves.
Couldn't have said it better myself.
That's a great point to end on. It's not about putting people into categories.
Nope.
It's about recognizing and appreciating the unique ways we all experience the world.
Well said. And remember, the more we learn about these conditions, the better we can create a world that's inclusive and compassionate for everyone.
This deep dive has been so insightful. Thank you so much for joining me.
Of course, it's been a pleasure.
Until next time, keep those brains buzzing.
Mm-hmm.